Hello, welcome to my frequently asked questions. Today I'm answering questions about tear trough fillers, everything you need to know about a non-surgical eye job, how to get the best results, how to avoid potential issues and risks. So what am I going to cover in this? Well, what are the 7 key things you need to know? What is a tear trough filler? What does it actually mean to have this procedure? Am I a good candidate? What are the alternative options? I'm going to take you through some of my personal before and after photos to give you examples of like what can be helped. What's the potential recovery? What are the potential risks and complications? How long does this treatment last? What are the potential costs? And my own personal tips from doing this. So first of all, an introduction about myself. My name is Dr. Julian. I work as an oculofacial plastic surgeon in London, and I've been completing these treatments for over 10 years, and I use a mixture of surgical and non-surgical treatments to give my patients the best possible results. Now this video is really for information and educational purposes and does not constitute a medical consultation. So what is a tear trough filler? Well, it's a non-surgical treatment. So it's a treatment that you can walk into a doctor's office. It takes approximately half an hour to complete, and you can walk out and you can do things as normal. And really, it's useful to help patients with changes in the lower eyelid area. And this area is sometimes called the tear trough. And the kind of things that can be helped is a shadow beneath the eye, a mild ring, a depression, mild dark circles, so a little bit in this kind of area here. So this is termed the tear trough. And filler, well, filler is added to this area in order to inflate this area and make it smoother. So you can see how afterwards, well, you don't have that shadow or ring, it just looks more even. What are tear trough fillers? Well, over 90% of fillers used now are hyaluronic acid fillers, or HA fillers, and this is a gel-like substance that exists naturally in the skin, exists in joints, and so a clever pharmaceutical company worked out how to manufacture it, and so it can be put into different areas of the face, and it can add volume and smoothen out shadows and depressions. Now there are other types of fillers as well, including calcium-based fillers, polylactic acid fillers, and these fillers can have a role but not in the tear trough. They can have serious issues and complications, and so really the only fillers that should be put in this area are hyaluronic acid fillers to give the best results. And then different fillers have different properties, and really we want hydrophobic fillers in order to reduce the chance of swelling. So let's have a look at this. What does this actually mean? Well, an HA filler is a clear, gooey, gel-like substance, as we can see in this video, and they tend to have water-retaining properties, so they hydrate soft tissues. And of course they exist naturally in the skin and joints, and so things like allergies, reactions, well, these are relatively uncommon with these kind of modern-day fillers. So why is the eye area important? Well, having a shadow under the eye, puffiness, dark circles, well, the connotations these have are people think, oh, maybe you're tired, maybe you're lacking in sleep, you're stressed. Now, of course, these are structural changes in the area of the anatomy, and so there's no correlation in terms of tiredness or lack of sleep. And you could be sleeping 12 hours a night but still have these anatomical changes in this area. Why are the eyes so important? Well, we look at people in terms of communication. The first thing you do when you talk to someone is you look at their eyes, and so it's so important in terms of how we portray ourselves. And in a way, I've conducted a lot of research in terms of the most beautiful faces, in terms of celebrities and models, and looking at the properties of their eyes, the characteristics, the width, the eye length, the proportions in terms of symmetry, has such a high level of importance in the proportions and balance of our faces. Am I a good candidate for having this treatment? Well, the best results are going to come if you have a mild depression in the tear trough, or mild dark circles or shadowing, minimal loose skin, because that can't really be treated by adding volume, and you're in good medical health. And what are the alternative options? Well, although non-surgical treatments is the core of this video, some patients are going to get a better result from a surgical correction. And the question sometimes is, what is going to give the best result, a non-surgical treatment or a surgical treatment? And it's probably worth mentioning at this point that a lot of creams are advertised as having an almost miraculous effect in the lower eyelid area. And most of the creams hydrate the skin and have a relatively mild effect in terms of improving the skin. So most creams, well, often patients have spent large amounts of money on creams and been quite disappointed by the fact that they make very little difference. Whereas non-surgical and surgical treatments, they tend to make a more of a definitive result. So when is surgical lower blepharoplasty going to be more useful? So this is an example of a patient, well, it'd be hard to really correct this with a non-surgical treatment. And the reason is there's just a bit too much puffiness. There's too much fat creeping forwards in the lower eyelid. And this fat really, with a non-surgical treatment, you can only add volume. You can't take anything away. So where there's more fat puffiness coming forwards in these kind of areas, it gets much harder to give that the best result with a tear trough filler. Dark circles, well, also dark circles are quite difficult to address just by adding volume because it's multifactorial. And with surgical blepharoplasty, not only can the dark circles be improved, but using fat transfer, using regenerative medicine techniques, all of these things can help improve the quality of the skin and improve that further. And then finally, if you have loose skin, particularly if you smile, if you get lots of lines and wrinkles, well, really the best way to treat that is to actually take away some of that loose skin, and that will give a better result. And that really means either lower blepharoplasty or a skin pinch in order to improve that. So what are the advantages of a tear trough filler? Well, it's relatively fast, it takes less than 30 minutes to do, you get pretty much an instantaneous result. Most patients have very little recovery, mild swelling, there's a small chance of bruising. It's a relatively comfortable procedure to complete, and the cost is significantly less than having a lower eyelid surgery or blepharoplasty. So let me take you through a few cases to give you examples of what can be improved. So a patient with a mild depression or shadowing under the eye, well, that can be largely corrected with a tear trough filler by filling in that shadow, filling in that depression. So particularly patients with quite mild changes can be really effectively treated with a filler in this area. Hollowing under the eyes, deeper hollowing under the eyes, or mild dark circles, well, these can also be softened by adding tear trough filler. Sometimes that can be used in combination with platelet-rich plasma to give the better result. Minor loose skin and minor dark circles, well, this patient, so it's quite a good improvement in this area, and as I mentioned to you, dark circles are multifactorial, so there isn't any complete way of curing dark circles. However, in some patients that can be really improved with a non-surgical tear trough filler. And post-blepharoplasty, well, blepharoplasty will generally give a much larger improvement than a tear trough filler, but very fine detailed changes, sometimes they're best addressed by having a little bit of filler even after a lower blepharoplasty. What are the potential risks? Well, the lower eyelid is a really challenging area to add fillers in that the skin is less than 0.5 millimeter thick. So even the tiniest imperfection, you can see it in this area. So it's a very detailed and very intricate area. The swelling in this area Well, there's a proportion of people who are just not suited to having fillers in this area because it can result in swelling and look unnatural. And too much filler added in this area just doesn't look good. In terms of the anatomy, well, there's a small risk of a serious complication, and that is damage to the vision. And the reason for that is injection of filler in around the eyes and the lower eyelid area. If some of that filler is inadvertently injected into a blood vessel, it can travel all the way to the back of the eye. And this is a photograph of a patient who unfortunately had such an issue. And what can happen is that filler can then damage the vision at the back of the eye. Now that risk is very small, and precautions can be taken to minimize that risk, and I will talk to you about some of those potential ways to do that. And the key thing is having someone who does this procedure understand the anatomy, you know, doctor or clinician who specializes in this area, who understands the potential downsides, and good precautions can be taken in terms of technique to largely avoid these issues. And why is this risk there? Well, this is an incredible architecture of the blood vessels in the face by anatomist Professor von Gunther, who used plastification to show all the blood vessels in the face. And you can see the incredible network of blood vessels around the eyes and the lower eyelid and the nose. And so that's why great precaution is required in terms of tear trough fillers. So what are the differences in technique? Well, a common way in which fillers are used is a needle technique, and that means there's a sharp point in which the filler is injected, and it can cause trauma to the underlying soft tissues. It can damage a blood vessel, and that's what ultimately we want to avoid. And they are quite accurate in terms of providing these treatments. A cannula is an alternative technique, a more advanced technique, where the cannula has a blunt tip, so it only slides in the soft tissues. It doesn't have any cutting properties. And so certainly in the tear trough area, it's a safer way of introducing fillers in this area. It's relatively fast to do. It still takes less than 30 minutes. However, it reduces the chance of damage to a blood vessel and ultimately an issue associated with that, and it reduces the chances of bruising, and so it can offer faster recovery. The other issue with these types of fillers in the tear trough is in some patients, the type of filler used, the technique used, and the genetics of the patient can result in this puffiness. And every week in my practice, I see patients who have puffiness after tear trough filler, and in some patients, we just need to dissolve that filler and then do lower eyelid surgery or blepharoplasty to improve it. And fillers that absorb water can result in puffiness, and this can just look unnatural. And this particular patient traveled a long distance to come and see me because her local doctors were not sure why she was getting puffiness. And after dissolving all of her filler, well, it wasn't initially so good because you could see this shadow and depression, which unmasked the changes that were there before this patient had filler. And then with lower eyelid surgery and combining that with fat transfer and laser, I was able to give her a much smoother and improved result. So puffiness is something I see more and more in patients who've had lower eyelid tear trough filler. And in some patients, it's the way the filler has been done, or it's the genetics of the patient themselves. But either way, it's something that can be reversed, but it's a two-stage procedure to dissolve the filler and then correct it with surgical blepharoplasty. Another patient, this patient had filler like more than 5 years before the surgery, resulted in puffiness. Didn't look so good once we dissolved the filler, but then after treating it with lower eyelid surgery, we got like a really nice, smooth result. What are the recovery from these kind of treatments? Well, some patients can have swelling for a few days. There's a small chance of bruising. And then of course, expectations is key because you can only add filler to these areas. You can't take away any of the puffiness or the loose skin. And there's certain things that you can do to reduce the chances of bruising and more swelling. Avoid blood thinners before the procedure. So medications such as aspirin, non-steroidal anti-inflammatories such as ibuprofen, Voltarol, well, you want to avoid those really for 2 weeks before the procedure. And then non-herbal herbal supplements such as fish oils, St. John's worts, these kind of non-herbal supplements can thin the blood, and so you really want to avoid those a week before the procedure in order to minimize the chance of bruising. If you do feel like there's a small bruise coming up, applying ice immediately afterwards will reduce the chances of that bruise getting larger. And for some patients, avoiding exercise just for a day, just to allow more healing, can be a benefit. How long do they last? Well, generally fillers in this area will last for at least a year, and in some patients they will last even many years. But generally, using the techniques that I've described to you, you can say it will last for a year, and then it can be repeated. What is the cost of having this treatment? Well, it's going to depend on a multitude of factors. The experience of the surgeon or doctor providing these treatments, the type of anesthetic that's used, is any anesthetic used, topical or local, the volume of filler that's used, the type of product, the technique used, and certainly the degree of regulation. And certainly this is an area that in the UK where there's going to be further regulation to really protect the interests of patients. Currently, we have the CQC that regulates clinics, and clinics that have a CQC regulation, well, the cost of providing that is more significant because the level of scrutiny, the level of due diligence is so much higher. And in terms of like unregulated clinics, well, in a way that is an issue, particularly in many countries where you don't need to be a doctor, you don't need to have medical qualifications, so you don't necessarily know the underlying anatomy, which can potentially be putting patients at risks. So what can the cost be? Well, it can be from a few £100s to actually a few £1,000, depending on the complexity of the treatment, whether it's used in conjunction with other fillers elsewhere in the face, and depending on that, the cost can vary quite significantly. So what are my tips for doing this for over 10 years? Well, in terms of fillers, the type of filler is very important. And not only is it important that it's a high hyaluronic acid filler, an HA filler, but within HA fillers, there's different properties. And you really want to have a hydrophobic type of filler. And that's a filler that repels water. Hydrophilic, water-loving fillers draw in water and swell. Now, those fillers are beautiful in the face, in terms of the cheeks, in the lips, where they add more volume, but in the eyes and the nose, we really want fillers that have properties that stay exactly how they are, and those are hydrophobic fillers. In terms of cost, well, in terms of the area, it's a delicate area, it's intricate, the skin is extremely thin, it's less than 0.5 millimeter thick. You really want someone who is an expert in this area. Unfortunately, I spend a lot of my time dissolving patients' fillers in the lower eyelids because of puffy changes. So although cost is important, the result is very important. Limitations in this area, well, it is a challenging area and expectations are key. If you have quite a bit of puffiness or loose skin or quite a deep depression, well, often you're going to get a better result from a lower eyelid blepharoplasty. Lower eyelid surgery can remove some of the puffiness, can remove some of the loose skin, so for certain patients it's going to give a better result. And for some patients, having a tear trough filler, well, it can be a stepping stone for surgery, and you can get an improvement. It doesn't improve everything, but it gives you an improvement, and then you can look to have a more definitive procedure in the future. So in summary, we've talked a lot about the different aspects of tear trough fillers. We talked about what exactly they are, who's going to get the most benefit from tear trough fillers. We talked about different case examples of tear trough fillers. We talked about the recovery, we talked about risks and about how to avoid complications, and we also talked about the costs, and I gave you my own personal tips. I hope this information has been helpful for you. If you have any other thoughts or any other questions, anything you'd like to ask me about tear trough fillers, please do not hesitate to contact me either through social media or through my website. Thank you for watching.